A warm welcome to all. My name is Abby Lawson, and I will discuss a cystic fibrosis treatment plan supported by research. A person's location and military standards have an impact, making CF a chronic illness. Additionally, many caregivers' approaches to managing CF are oriented toward short term fixes, which is harmful to patients who live in rural locations where accessing comprehensive care can be difficult and result in severe respiratory exacerbations. PE. Consequently, additional work needs to be done to determine how raising PE's specific method might affect the health outcomes of CF patients, leading to more significant morbidity and mortality rates. Therefore, inadequate healthcare access for CF doctors causes poor crisis management and declining patient outcomes. This includes treatment options, drugs, and medical specialists. I will discuss a scientific proof technique in my address, which may be utilized in Caitlin's case representation from Villa Healthy Diet to assist other CF patients and personnel. The Valley Hospital made a dual enrollment for Caitlin, a 2-year-old infant. She initially tries to go to the clinic but gets agitated about bronchitis and discomfort. After completing several studies, including those about the participants' weight growth, perspiration, and mucus discharge after chest physical therapy, the CF diagnosis is confirmed by Dr. Copeland. Penicillin and hepatocellular trypsin IV infusions were started. The nurses were in charge of monitoring her vital signs throughout the whole hospitalization. Caitlin's health indicators from the protracted diagnosis may worsen because she cannot make the hour-long commute to work for emergencies because of her parents' incredibly demanding work schedules. Dr. Copeland faces a dilemma because of it and the whole medical team. In the search for resources to help Caitlin manage her CF, the hospital learns that Dr. Benjamin is a skilled physician who performs in McHenry. In order to find him and plan a visit so that doctor may analyze Caitlin's wellness, Copeland asked the child's nurse. It is incredible how much knowledge the doctor has about cystic fibrosis. Once it is discovered that the psychiatric residency does not have the necessary drugs to treat CF, there is just another problem. Dr. Benjamin, however, agrees to collaborate with River Hospital to aid Caitlin's recovery. Texts and emails and the internet will be utilized for communication. However, the medical professional and the McHenry free social worker argue over whether the parents' insurance would cover the child's medical requirements. Thankfully, they discovered that Doug's security was adequate and that groups like close relatives gave them social support. She gained valuable knowledge about modern technologies that Caitlin's mother may rely on once it is released. Her mother had to employ several types of equipment, including crucial chest therapy, to cure Caitlin's genetic disorder. The equipment in the facility, which included measurement tools, weighing scale items, and inhalation monitors, allowed her to take care of Caitlin's health reasonably. Furthermore, she was given a lot of physicians she may call in an incident or for more information. The fact that Caitlin's mother and reliable internet access was advantageous since it made it quicker for her to use Skype to get in touch with the doctors whenever she needed aid. She received Skype guidance from the medical center. It is vital to utilize the best strategy possible, especially one that thinks about CF patients. Cystic fibrosis patients in rural locations now have better access to care because telemedicine can get around resource constraints. Since COVID-19, when an initiative was made to implement it, it has demonstrated its value. It is advised that patients with CF frequently visit specialized facilities since they need intense care. However, telemedicine allows patients to access care, especially from on-call doctors who would otherwise not be able to pay to meet a patient face to face. In this situation, the physicians may place the required prescriptions on the telemedic platform of the Valley Hospital while maintaining contact with the child's mother via SMS and webcam, particularly in the case of a crisis and at any of the child's monthly follow-up meetings. Any uncommon symptoms should be managed with peer assistance and education, and the patient should be notified via Skype with a chest specialist. The doctor's efficient and secure certification of Caitlin's chest measurement can be seen on the respiratory monitors. Based on the information acquired and the results from the surveillance equipment, which will instantly offer truthful specifics on temperature swings and heart fluctuations, doctors will be capable of making changes and evaluating whether there are indications of improvement. Telemedicine is crucial for improving Caitlin's condition as it prevents delays in providing the necessary care based on the combined functioning of numerous reliable technologies and such as lung monitors. It will also physiologically aid in controlling any other problematic situation. Caitlin's most appropriate treatment plan was developed using the Johns Hopkins model. It consequently provided the most incredible possibilities for finding a solution. The procedure consists of 4 stages. Which drug will work best for Caitlin, for example, and how should Caitlin's health be evaluated in the first place to answer queries from the community about CF patients? Can the caregiver access the internet from any of their homes? What ways will the medical specialists on the team collaborate going forward to manage any possible symptomatic severe symptoms? What kind of assistance is available? Second, the expertise is distributed to boost Caitlin's health. Even after Caitlin's condition was believed to be terminal, psychological factors aided her stance. Initially, Caitlin underwent traditional medical care, including aerosol treatments and chest exercises to help reduce the fluids obstructing her airways and leaving her prone to pneumonia. Caitlin's condition was also improved by telemedicine, which included teleconference notes that permitted them to consult with the physician whenever a problem arose. The choice to adopt a telemedicine system and collaborate with multiple medical specialists resulted from the urgency of Caitlin's diagnosis. Due to Caitlin's guardian's longer work hours, the hospital decided to use telemedicine interventions. Telemedicine solutions improve treatment delivery, lessen the strain emergency hospitalization has on healthcare institutions, and improve patient care for those who live in remote locations. Caitlin's mother frequently stated that whenever she believed Caitlin's chest physical therapy was harming her daughter out of concern for Caitlin's well-being and out of no wish to inflict damage. For instance, Caitlin's stomach was affected negatively by red spots. The mother questioned the doctor about it since she wanted to ensure she followed all the instructions. Interdisciplinary team working simultaneously ensures Caitlin's continued evaluation, lowering the risk of regression and rehospitalization. The situation necessitates care from specialized doctors in the comfort of their homes. Telemedicine advancement has solved the obstacles to interdisciplinary teams' capacity to work together. The application of a well-known healthcare tactic was credited with the accomplishment. Regardless of where in the globe CF patients are situated, using evidence-based practices and cutting-edge medical advances can improve care quality and safety. Additionally, medical professionals can improve patient-centered treatment that will improve the situations of CF patients by verifying that the patient's illness is treated systematically rather than in remote locations. Modern technology will help patients achieve the most outstanding results with a lower chance of readmission and cheaper medical costs. Patient satisfaction is eventually increased by successfully combining an intelligent framework and using the most recent scientific findings. Thank you.